What happened?
Sometimes during an illness, it's much more convenient to receive care at home than go to an emergency room. That's especially true for the elderly. That's what home care physicians is all about. They make house calls to the elderly. Dr. Harold Wagner is the medical director and joins us this morning to tell us more.
Thank you.
I'm so glad that you're here. I was talking to you a little bit earlier, and you've got such a passion for this. How did all of this begin for you?
Well, I'm a board-certified registered-trained trauma specialist, and back in the late 90s, I noticed quite a few patients would come in with the lack of medical care with illnesses that could have been caught earlier. So I talked with Home Care Network and started a system where we would make house calls to elderly patients to prevent them from becoming sicker.
Yeah, you were a trauma doctor, right?
Yeah, yes, I was at Methodist Hospital of Dallas.
But you said this is so much more rewarding for you.
It is rewarding because I not only save the patient time, I save the family time, I save a lot of money for Medicare, and we deliver services in the home so the patients won't have to go out.
Well, you know, house calls, that's the way medicine used to be practiced. We've gotten so far away from that. I didn't think anyone made house calls any longer.
Yes, we do. It's myself, another physician, and we have 5 mid-level PAs or nurse practitioners that are board certified, and they make house calls also.
We're looking at you making a house call right now, and this woman looks so very happy. Look at you, all the love there. How does this work? Explain this to us.
They call the office, and they arrange for one of us to come out and see them, and we do all of their medical care in the home. We do x-rays, blood work, sonograms, echocardiograms. We get them ready for surgery in their home, and Medicare pays for these services.
So anyone with Medicare is eligible for this?
Medicare Part B, yes, and some private insurances.
Okay, all right. So you're taking x-rays in the home. What type, is there anyone who you could not care for? Who might be the ideal patient?
I have over 100 bedridden patients or obese patients that cannot get out through the front door. Normally, elderly patients and patients that have difficulty getting out of their home is what we mainly focus on. And now we do in-home hospital. Patients that have pneumonias, infections, congestive heart failure, instead of treating the patient in the hospital, which is traditionally what was done in the past, we treat them in the home with IV therapy, x-rays, blood work, nursing care, and respiratory therapy care.
What type of reaction are you getting from your patients?
Patients, well, the families love it. Now I'm seeing second generation patients. I'm seeing the children of my original patients because they say, hey, if you're going to come and see my mom, you might as well take care of me too. I don't want to wait in that doctor's office.
Right. And this all started with one
visit, one house call.
That led to another and another, and referrals, as you said.
Yes, referral basis
from
patients.
And you cover most of the Dallas and Fort Worth area?
Yes, our practitioners go to Fort Worth, Midlothian, Waxahachie, Ellis County, all over.
Wow. Is this one of the most rewarding things for you? Yeah.
Yes, even though I'm a trauma specialist, I enjoy doing this a lot more because it impacts the family in more ways than you can imagine.
Wow. Well, I don't know if we can get a picture of this, but it's just amazing that because of technology, you're able to make these house calls. And this is an image of an x-ray that you were able to get within 30 minutes.
Yes, the x-ray was done on that patient yesterday evening. I was looking at it at 7:30, and I called in the prescription so the patient would not have to go to the hospital or anywhere else to be treated for this bronchitis.
I just love it. Thank you so much for what you're doing. All right, if you want to find out more about home care physicians, call 972-572-1998 or email Dr. Wagner at wagnermedical@sbcglobal.net. We'll be right back with na 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 Elmo's World. We'll be right back.